Good afternoon, everyone. It is nice having you guys around, and thank you for stopping by. Today, the 9th of January 2025, I will be discussing human metapneumovirus, HMPV. Are we heading towards another lockdown? Do we have one around the corner as we did during COVID pandemic? Is HMPV a COVID mimic? So what is HMPV? It is a human metapneumovirus, which is a respiratory disease that causes flu-like symptoms. It is a seasonal virus, with most cases occurring in winter, and is closely related to respiratory syncytial virus, which is one of the common viruses that causes common cold. And what are the symptoms that you would expect for people with HMPV? It is a mild infection and similar to those experienced in common cold. Symptoms can range from just runny nose, cough, mild temperature to severe temperature that is unremitting, sore throat, wheezing, and feeling generally run down, just lethargic. And who are at risk of developing severe disease? Normally, people with immune-mediated diseases, immune suppressive therapies, or people with attenuated immune systems. Children, elderly, and young children, or people that are on cancer therapy or any disease modifying drugs, or being pregnant, or having other severe comorbidities. HMPV, is it a coincidence or chance, fate, or design? Is the world ready? Are we ready in the UK? With us being in winter, probably a coincidence, but this was a similar time that COVID started in 2019-2020. It is likely that cases will continue to surge as people return to normalcy, going back to work, the kids going back to school, starting our social lives again and social interaction. Additionally, in winter, when we are usually in serious pressure on NHS, having any increased viral illness can put a significant strain to the already stretched service. This is also usually there is also usually an increased morbidity and mortality during this period. Hence, I am filled with a mixed ambivalent emotions of this news of HMPV. I recall myself with COVID ordeal in 2020. Have a watch of this clip. This is a summary of me contracting COVID in March, April 2020, when I was 24 weeks pregnant. I was saved by God's divine grace and excellent care that I received from my colleagues and great staff of Birmingham Women's Hospital. Both myself and my great miraculous twins eventually came home with our lives. Hence, I feel duty bound to raise my voice at this point in time that's almost 5 years from the previous pandemic. As this current virus reminds me of a similar pattern with COVID-19. Once it's been reported that HMPV was first described by Dutch scientists in 2001, I must say that we had always been worried about influenza and RSV during pandemic. But HMPV isn't what I am aware of that has caused such an overwhelming headline in the media. Additionally, cases have quadrupled in the last month, as reported by NHS England, from about over 8,001 on the 1st of December to over 4,000 of flu patients on the hospital beds in England hospitals in the last week. So what a great increase. Additionally, Chinese hospitals have been overwhelmed with increasing cases of this virus. Should we be worried? Likewise, in the UK, parts of Europe and United States, there has been significant increase in the number of people getting ill with this virus. As I said earlier, respiratory syncytial virus and other viral illness are very common during the winter period. But with this smelling like what we saw in 2019-20, what are we doing? What have we learned from previous pandemic to prepare us for the current increasing HMPV cases? And in the worst case scenario, if we ever happen to land into another pandemic, I think it is not a time to criticize any country, including China. As we did notice during COVID pandemic, there were a lot of criticism on how Chinese was handling COVID pandemic. But we ourselves got overwhelmed when it landed around the shores of the UK. We have to be asking, what is Chinese people doing? What can we learn from what they are doing? What are we doing to ensure that we understand the current strain of HMPV and its epidemiology? Cases have been reported in India and US as at yesterday, increasing virtually every day. It's important that we get more information by collaboration to understand how we can improve our management strategies. This will help us to prevent the previous mistakes we made. Let's not play geopolitics with it. World Health Organization has a role to play in making sure that HMPV is contained and not to escalate to being a world pandemic. Everyone across the world must sit up and reflect on what we learned from COVID pandemic. The importance of information sharing amongst all countries cannot be overemphasized. This will support the globe in making sure that we contain this HMPV, understand the strain, and know what is ahead of us. Is there a possibility of another lockdown as happened during the COVID pandemic? If I may ask, did it work? Apparently, I would say that there was a short-term fix, probably because it helped reducing case numbers by reducing the amount of virus out there through social interaction. But in the long term, I think it was herd immunity that helped us from coming out of COVID pandemic. That is my own personal point of view. From my clinical practice and experience, we knew that of many people that went ahead to develop severe COVID post-vaccination. I've also noted with a very close friend of mine, may her soul rest in peace, who was completely well under the age of 40, no previous medical condition, fully vaccinated, and went ahead to die of severe COVID. My experience of vaccination can be mixed. I was a part of a study which confirmed my COVID antibody level was persistently and remained high up to the end of that study, 2 years after my COVID ordeal. So my natural immunity was strong to be at a treatment level up to 2 years post having COVID. There was an argument that people that developed COVID from alpha strain at the start of pandemic were able to build stronger immunity. Whilst I would recommend that those eligible for vaccination should have it, I would strongly recommend that people are allowed to make their informed decision regarding vaccination and regarding what they would accept in their body. There should not be any imposition as done during COVID, and that should be frowned at. I would also Recall that COVID-19 vaccine clinical trials were designed to study the vaccine's safety and efficacy in preventing symptomatic disease, but not transmission. The other tricky thing with COVID was the fact that it was constantly mutating and changing. And I just asked myself, would HMPV, the current strain that we have, mutate like COVID? Hopefully not. We would need to watch the space regarding this. I hope that it doesn't. We did know that COVID had high mutative capability, hence, there was greater chance for the COVID to escape even part of the vaccine. This again affected its efficacy. It is what our moving fast as a rocket to seek knowledge of managing, preventing, testing, and treating. Our knowledge from COVID management would undoubtedly be a bonus for managing our very unwell patients who may require antiviral, antibacterial for superimposed bacterial infection, steroids, etc. This is depending on individual case. My experience of COVID and vaccination, as I did say earlier on, was a mixed feeling, probably because of personal experience and what I saw in real life. How do we compare HMPV and COVID-19? Both smell the same. However, the difference is that COVID was completely a new and novel virus that was drastically and speedily mutating from alpha, beta, delta, gamma, you name it. Both viruses affect respiratory tract system. Whilst COVID was a new virus that started in China, HMPV has been known since 2001. The curious thing about it is the way it is currently behaving like a pandemic-like picture, as we saw with COVID. There is again some mainstream media propaganda suggesting information hoarding by the Chinese and other countries criticizing China. It is a moment of collaboration. It's a moment of seeking information. If it means countries coming together in a table, in a point to discuss way forward and understanding what is happening with HMPV, I think that will be the way to go. Again, during COVID, there was denial that it was just a normal virus until it was boom. Worldwide data secrecy and manipulation was also the norm at that point. Countries were working in silos. There was scarcity of PPE, personal protective equipment at the start of COVID pandemic, which is not currently seen with HMPV. And from my background as a doctor, my advice would be to keep up with a very good and excellent hygiene, hand washing, and hand hygiene can never be overemphasized. I would strongly recommend that whenever you go out, please wash your hands. Wash your hands. Wash your hands. Before you touch your face, wash your hands. The areas that are commonly touched, like door handles, the tables, please clean it with antiseptic wipes to make sure that it is devoid of infection. Use hand gel whenever possible. Use your personal protective equipment whilst working in hospital. Reduce social gathering whenever possible. If anything is new or you start having any flu-like symptoms, please seek medical advice. Ensure that you are well hydrated. However, if you continue to have unremitting fever after 48 hours despite paracetamol, please seek help from your GP. Call NHS 111 for advice or attend your local emergency department. And I would be able to come back again to discuss further updates on HMPV. And watch the space on full update of my journey post-COVID ordeal till date. Thank you for watching. And please do not forget to subscribe, like this video, give it a thumbs up, and I will see you soon. Thank you so much for watching.